our grandfathers forgot the names with ages. But now we tend to forget why did we even open our phones. Here the problem is not about age or aging. Instead, it's about the changes happening in our brain. And the most scariest part is that we often tend to ignore it unless it affects our daily life.
Hi, I am Sukruta, co-chair of Health Vertical CII. Would like to welcome you all to the Healthcare Podcast, which is initiated by Young Indians Mysuru chapter in collaboration with Apollo BGS Hospital, Mysuru.
Today, health problems are not visible. It's silent, gradual, and in this case, it's happening inside our brain. And to know and understand more about brain and the functioning of brain, we have here with us today a renowned neurologist, Dr. Somanath Vasudev, who has been in this field for more than 2 decades.
Doctor, to begin with, what is neurology and is it only connected to brain?
Neurology is the science that deals with the functioning of the brain, spinal cord, the nerves, and the muscles. So, and all the sense organs. So it's a bigger supercomputer, or the best supercomputer in the world. No supercomputer can actually beat the brain in this way because it does a lot of functions. It's unlike any other organ in the body. There's a lot of functions that keeps doing all these functions continuously without us knowing. So it's a like a full set of wires going from the brain down to the end organs, wherever it is. It's a biggest system in the body, most complex one.
So what are the diseases which are usually related to neurology?
So any disease that affects the brain, the brainstem, the spinal cord, the nerves, the muscles, and any of the sense organs would be called a neurologists. For example, the commonest, I'm just telling you the common disease. The commonest disease that affect the brain are headaches. It's a commonest symptom in the world. The headache is the commonest, isn't a big deal. So headaches, epilepsy or seizures, or as the general public would say, fits, and the stroke, which is very important. The most important neurological disease is stroke, and there are these diseases that affect the nerves, like neuropathies. We call it as neuropathies, muscle diseases, myopathies. So there are a huge list of diseases that the flavor in this country. Commonest being headache, epilepsy or stroke, epilepsy fits, stroke, neuromuscular disorders, Guillain-Barré a lot of other diseases.
I want to particularly highlight about headaches and migraine now. So what is the difference between a normal headache and a migraine?
Okay, first point I told you is that headache is the most common symptom in the world. Pain is the most common symptom in the world, of which headache is the most common pain. Okay, and headache is so prevalent that what you are calling normal is just means headaches which come commonly to most of the people here. So there is no normal headache. Headache is always abnormal because why you are feeling normal is you need common headache, not normal. Headaches are normal, and you should be you should surprised to know that there's an international headache society. That's the one which gives a classification for this. There are 14 different classifications of headaches, different types of headaches, and of which one of the commonest is migraine. And so that is the most of the time what you see called as common headaches. You get a headache when you go out into the person, when you go out travel, if you're tired, when you're stressed out, you get a headache. Most of the time there will be migraine headaches, or it will be also what's called as tension type headaches. So these are the commonest headaches. Headaches can be both primary and secondary. Primary means there is no particular reason for that headache. Whereas secondary headaches are those which have happened as a consequence of certain conditions, say like a stroke, a bleed, a tumor, trauma to the head, or DNA, eye, any of these causes, or systemic diseases. They are called as secondary headaches. In fact, primary headaches are far, far more common than secondary. But for the public, if you ask the public what is the commonest cause of headaches, they'll say sinus. I have sinus headache, or then I have a tingle. They are not. Actually, the primary headaches are most common headaches.
So can it be reversed by any chance?
Migraines are usually genetic. That means they are hereditary. They will run in the family, and they cannot be cured. The most important thing in treatment of migraine is that you have to do is the patient doing certain things to bring lifestyle confidence. Medications are second. So the first thing that you have to realize or find out is the triggering factors for your headaches. So there are certain triggering factors that you go on with the hot sun. Yes. You don't take your food on time. You don't sleep well at night. You overwork yourself, stress yourselves. When you go to any of these functions, all of the house, sound, lights, even your lights here, if you have migraines. So these are the triggers that you should look out for. And if you have any of these triggers, if you try to avoid, that's the first thing I tell my patients. Like they have to avoid these triggers somehow. It's not and certain foods. Okay, most of the time it's chocolates, Pepsi, Coke, sweet cheese, butter, ghee, too much of masala items, all this sweets, junk foods. All this can trigger headaches. But I'm not telling that all this will trigger headaches in all cases. Okay? You have to find out which is the food that triggers headache.
Since you mentioned about foods, doctor, now we are in the cafe area where high processed food, high fat food, high protein food, or caffeine intake is more. So I've heard a lot of things that caffeine is good for brain.
Caffeine is a stimulant. It isn't just a stimulant. It's not that it's good for brain. Caffeine is a stimulant, so it makes you stay awake. That's it. But it's in the long run, too much of caffeine is definitely not a good thing for the brain because it is filing the brain.
Okay.
So it's not good. Even migraines can be triggered by too much of caffeine. You can get sleeplessness, anxiety. All these things can be triggered by caffeine. So it is better that you do not take anything you take in moderation. Good. If you take anything in excess, it's not.
Right. The next, talking about the next major issue that we get to see is epilepsy.
Yeah.
So how is it?
Yeah, epilepsy. First thing I want to highlight is epilepsy is a neurological. So problem with epilepsy is there. It's true. So for many years they have been taking it as a psychiatrist. So they go to the psychiatrist. They go to the take them to alternate systems of medicine. They take them to the some temples or anywhere religious places to get rid of epilepsy. It is not a psychiatry. It is just a pure neurological disease.
So how do we get to differentiate? Because if you have anything, we definitely, how do we even differentiate between a neurological and psychiatry?
Yeah, the problem is, psychiatry is a subject that deals with disorders of the mind. So any of these behavioral problems, behavioral diseases comes under the bucket of psychiatry, right? Neurology per se is dealing with diseases of the brain. Now, you'll ask me where is the mind?
Yeah, what is mind and brain?
The brain is the physical structure. Mind is somewhere inside that place.
Okay.
Inside that. So mind is some circuits inside. In some parts of the brain are involved with behavior. And that area, emotions, that area is connected or associated with psychiatry. So anything that affects that part of the brain produces psychiatric disease. The common psychiatric disorders like anxiety, psychosis, depression, all these things are disorders of this part of the brain. Basically, neurotransmitters or chemicals in the brain which are affected produce anything to psychiatry. So they are most of the time behavioral and emotional disorders. Whereas brain disorder like headache, epilepsy they are not the past stroke or neuromuscular disorders. So many other disorders. They're not basically disorders of the mind. So here, epilepsy earlier for many years has been wrongly thought as psychiatric disorder. It is not a diagnosis. It is a neurological disease. The simple thing is like, the brain consists of lots of neurons and they're all like we call it as dipoles. They're all like cells which keep on firing. So there is an electrical activity going on in the brain continuously. The thing is, there are trillions of neurons in the brain. When the voltage that each neuron comes to millions of volts, millivolts. Right? So what happens is none of these neurons fire at the same time. So the total voltage remains low. What happens if a small group of neurons suddenly fire together? Now that produces a spike of voltage. This is exactly like what happens in our house when the voltage suddenly goes up. What happens? Your bulb fuses or your TV goes flat. The same thing happens. Depending upon where that surge is in the brain, you get so many symptoms. So it may be like I am just talking to you, suddenly I get stop. So I'm speaking to you, suddenly I get stuck. I don't speak. And then I do sound of automatically.
So your brain stops.
The brain stops, and in that part of the brain, you get excess firing, and these things happen. So that is called as a complex consciousness. There are other kinds of absence issues where, suddenly speaking, especially happens in children. They are suddenly, for a very brief period, so 2 to 3 seconds, suddenly they just stare, they're back. Right? This happens. But the problem is there are so many different types of seizures, but for the general public, they have only one fear of the generalized seizure where they fall down and get the convulsive arms or both hands and feet. Then they have rolling of eye and all those things. That is the common type of generalized seizure. So there are different types of seizures. All of them happen because there is an electrical disturbance in the brain. It is a very simple problem, but it's so terrifying for others to see. True. And one thing I wanted to mention about is in the treatment of epilepsy. You must have seen, even people of your generation, young people, I want to tell you, because the young people, I've seen them, techies in Infosys and Wipro and all that, they come, sir, my colleague, he had a seizure. I gave him a key.
Exactly.
I gave him a bunch of keys. I tell him, you should have given your pen house. You should have stopped. You have given some plastic, you should have stopped. No, that has absolutely nothing to do with stuff.
That's the biggest myth.
That's the biggest myth. Going, finding out the key, coming back and giving it to them, people take one.
I think even I've heard a lot of stories that you have to give them iron.
Going and finding out an iron and whatever, or a key, and coming and give hours. It will take at least 1 minute. The seizure usually stops at 1 minute.
Okay.
The seizure usually stops at 1 minute. After that, they will be sleeping or unconscious. So that is the biggest myth. I don't know, that should be removed. The most important thing that you should do when anybody is having a seizure, put them in a safe place. Put them on the ground, see that they don't get hurt themselves by the furniture. See that their throats are loose so that they don't choke. See that their head is tipped to one side so that they don't choke. Or whatever secretions are. Just the saliva comes out, it doesn't go into the thing. That's all you need to do. The seizure will stop.
What if they bite their tongue?
That happens in the first part of the seizure. You have absolutely nothing to do because that happens first. There's no point putting your fingers into his mouth or maybe putting on steel spoon. All that is causing more harm than benefit. You should never do all those things. Just putting by the side, putting down, putting by the side, turning to the side, the head down. That's all. In 1 minute's time, it will stop. After that, it will be sleeping. 15, 20 minutes later, they come back. That's all you need to do. But if it is going beyond 5 minutes, 10 minutes, immediately call the ambulance and take it. Because that is dangerous. That type of seizure is dangerous, but there's something which can perpetuate continuing seizures. And continuing seizures activity will produce brain damage. So anything going beyond 5 minutes, immediately call the ambulance, take it to the hospital.
Okay. So why do we see this more often in youth today?
See, there are a lot of diseases which are more often seen in youth nowadays. Not only epilepsy, not only neurology, even other diseases. Partly, one thing could be, we are probably speculating, one thing that COVID which happened at COVID has produced a lot of problems. So there are speculations that COVID has increased the risk of stroke. we are seeing a lot of young strokes after the COVID. We're not sure. We need a lot of studies to really prove that. Okay. The other issue is stress. Stress among the youngsters, the younger generation, there is something really affecting them, and that can produce most of these neurological disorders will be made more severe or happening more commonly in these youngsters of this day.
So now we spoke about migraine and seizures. Doctor, I'm curious to know what is stroke then?
Yeah, stroke is the most important subject in neurology because for years, stroke was considered as something that cannot be cured.
It can be cured?
Yes, that is the difference now. The thing is, now we call it as brain attack. So they want to give it the same importance as heart.
At that time. Nice,
Right.
brain attack.
Brain attack. Because stroke is, you don't know what stroke. Sometimes I have a brain stroke. Stroke happens only in the brain. Stroke doesn't happen anywhere else. It is the same thing as heart. The same thing that happens in the heart, if it happens in the brain, you get it. Now the commonest cause of death, number one spot comes heart.
Yeah.
Number two comes stroke. So it is as severe as diagnosed as heart attack. But I would say worse. If you ask me, do you want to get a stroke or a heart attack? I would say heart attack. Because if I get a heart attack, either I will die or I will be saved.
Yeah.
That will happen.
True.
If I get a stroke, either I will die. But if I don't die, I will be left with a disability forever.
Okay.
So that is the thing. Now the good thing is that nowadays, stroke we have got treatment. So as I told you, stroke is a disease where there is a blood supply is cut off into the brain, any part of the brain. And because the brain is such a big, complex organ, it's got multiple functions. That is the reason people don't realize when they're stroke. So they may be getting some tingling sensation in the hands. They will think, oh, so just because I was slapped on the hand, that's not right. Anything which is neurological and which comes suddenly, anything which is pertaining to your nervous system, which comes suddenly, you have to take it. It may be something else, but you have to take the stroke and come to the hospital. So there may be sudden stoppage of speech while speaking, sudden onset of weakness of the limbs, or sudden onset of visual loss. You're not able to see anything. Or so depending upon which part of the brain is affected, you may be having some slurring of speech. You may be having giddiness. You may be unsteady while walking. Any of these symptoms should first be taken as stroke and come to the hospital. The reason being, till now, in the last maybe 15-20 years, there is no treatment. But the last 15 years, so much of progress has happened in the treatment of stroke. If you come to the hospital immediately I would say, because
within 5 minutes, you have any buffer time?
yes, the time for us to give the treatment is between 3 to 4 hours.
3 to 4.5 hours.
But I don't want you to waste time at home and wait for 3 to 4 hours. Why? Because each minute, 1 million neurons are dying. Each minute. So each minute is important. So that's the reason we call time is brain. So you have to come to the hospital at the earliest. Don't wait for 3 hours. Problem what happens is, first thing they will tell, okay, let's go to alternative system. Right. There are certain places in and around Mysuru, Madhu, all those things are nonsensical. They don't go there and waste their time. Or they can go to some clinic and wait for the doctor to come. Doctor will see after half an hour, then they will be sent for a scan. You go get a scan, they will give up the rate. By the time they come back, time is gone. So that is not the issue. You should go to what is called a stroke-ready hospital. Now, what is a stroke-ready hospital?
There are different types of hospitals.
We have, the thing is, we have quality standards now. So a stroke-ready hospital is something that is given to the hospital, a quality indicator given to that hospital. A stroke-ready hospital is something which has all the personnel, neurologists, neurointerventional radiologists, neurosurgeon, the stroke team consisting of the nurses, the junior doctors, all the other supportive staff. They are all, we have, for instance, in our hospital, we have what's called as a cold stroke. Cold stroke, whenever it is one, you immediately activated whole stalking. All these people are immediately involved in the treatment of that patient. And then, personal equipment. We should have the best imaging facilities there in the hospital, not outside. The CT scan, the MRI scan. You should have a cath lab for immediate treatment for the procedure. And you should have neurosurgery OT for the operation theater, for OE surgery. All these constitute for stroke ready. So you have to go to any stroke ready hospital at the earliest. Because every minute you are losing millions, 1 million euros. So you go to the hospital, we give an injection after, because they take some time, We have what is called as a door to needle time.
Okay.
A door to needle time is usually world standards, they say is 60 minutes max. Not the amount you 60
That's time you enter the emergency.
From the time to enter the emergency till the time we give the injection is 60 minutes.
Okay.
So in that 60 minutes, we have to do all this, examine the patient, do the scan, and everything has to be finished within 60 minutes. Now, the good thing that we here in Apollo hospitals, we do is that most of the time we finish less than 60 minutes. The earlier the better. So as early as possible. So all these things are done in stroke ready hospital. You cannot just go to any clinic and do this. You have to go to the stroke ready hospital so that the patient gets the treatment at the earliest. And the satisfaction that you see when the patient comes with the paralysis and comes immediately within few minutes or hours becomes perfectly normal. Or a patient who comes without speech starts speaking. That is, you cannot understand immediately. They really so satisfying.
True.
And for the patient also, imagine, for life, if you are left with a weakness of one side, paralysis of one side,
disability,
you may be the breadwinner for the family.
dependency,
The whole thing, for life, your whole family is affected. That is the reason I'm telling you, stroke is the most important thing in neurology and the most ignored or neglected thing in the general public. They don't know what is stroke yet, even though.
I think, doctor, the biggest problem here is not the disease, it's about the awareness people have.
Very.
So, next, how do we know that we have this or not? Like, what are the common symptoms? Because we told headache. I think most of us here, the youth out there, will be having headaches.
Yeah.
So,
As I know,
or sometimes we get brain fog. We'll be talking and suddenly we stop because I don't know what we are thinking about.
That's what I was telling you. Since brain is a really common one, having lots of other functions. That is the reason people are not identifying stroke. The common symptoms. First and foremost, important thing is that anything which happens suddenly.
Okay.
Not suddenly, while I'm speaking, suddenly I lose speech. I'm not able to speak. Or while I'm walking, suddenly I feel weakness on one side. Suddenly I'm feeling numbness on one side or one
So what if we have the symptoms over a period of time? So it's not neurological.
No. When it happens suddenly, not neurological, not stroke.
Okay, you're talking.
When it happens suddenly, you have to take it as stroke. Anything which happens suddenly, you have to take it as stroke. Sudden visual loss, sudden inability to speak, sudden inability to understand speech. Suddenly you're walking in unstable manner. You have sudden loss of consciousness. Any of these things would be stroke. Should be taken as stroke. It could be stroke, could be other things also, but should be taken as stroke. The other thing about stroke is there are two different types of stroke. One is ischemic stroke, other is hemorrhage. Ischemic stroke is what I was talking to you about, where there is a reduction or cutoff of blood supply in one part of the brain due to some blockade in the blood vessel. The other type of stroke is hemorrhagic. So brain attacks are good, but other are only one. Brain attacks, the other type is hemorrhagic, where the blood vessel bursts and there is bleeding into the brain. So the treatment is exactly opposite to ischemic stroke. In ischemic, we're trying to open up blood vessel. In the hemorrhagic, there is no such. Because if you open up, give that medicine, you will be more bleeding. So you try to reduce the bleeding, stop the bleeding, remove the bleeding, all these things.
So, doctor, talking about the neurological disorders, completely everything. What are the symptoms? Because we face all kinds of symptoms. So, which that we shouldn't ignore. But as soon as we have it, we have to consult a neurologist.
See, about youth that the present day youth, there are as I told you, most of the pain get happened around stress, especially those working in this the IT companies. Not only IT companies, any company, anywhere, any corporate.
If you go and ask the school, can even say, I do have stress.
Everywhere there is stress. Even for children, there is stress.
Yes.
So they have to compete with that. So many students are they are getting their top marks. All those things are there. So anywhere there is stress. All this stress and affect. I'm talking about neurological conditions. Stress can worsen any of these neurologies. So epilepsy, migraines, will give worsen. It takes will give worsen because all sorts of pains. All sorts of pains will be worsened with stress. So we have seen many of these people come with pain.
Oh, yeah.
Most of these people
Laptop.
on the laptops or working at the not only people working on laptops, everybody's addicted to mobile. You keep your smartphones like this and look into the smartphones all the time, you will get 100%, you will get pain. So that they will get all sorts of pain, neck pain, headache, eye pain, and they will get numbness or parts couple numbness, we call it as epileptic stress injury. They will get numbness and incendiary sensations. And these are all very common now because of this lifestyle. And so all sorts of pain will be worsened. Memory instructions. If you are always in a stress condition, they are all likely to develop dementia early. So memory disturbances early, and then they can have behavioral changes. They can have psychiatric irritability. They can be depressed. They can be depressed. They can become anxious. All that will affect their product. So that's another. I don't want to go into psychiatry.
Yeah.
I feel not about neurology. If you talk about neurology, I study, strokes. They are at higher risk for stroke. All this stress produced. We have seen so many youngsters having with stroke now. But there are other reasons also, but stress is one of the factors which can produce or trigger a stroke.
Doctor, now since we are used to this scrolling and real addicted generation, so is that 10 seconds or 20 seconds? Is it concentration is reducing? Or do we have anything related to it?
These people are always, very up to keeping on scrolling. One thing is you have a problem with the thumb. You get problems with the hands, with upper lips, all this tendinitis, all this pains here, all this. That's one thing. The other thing is about affecting the brain. Is your concentration. You will develop attention deficit. Attention deficit. It makes you concentrate.
It just reduces our concentration.
You are only. No, don't concentrate. 10 seconds, 15 seconds.
We get bored. Yes, we just change.
They want everything like that. In life also. Everything should be fast and sharp. That's it. They lose their patience. They don't have patience. So everything is, all these things will be.
Doctor, can this be prevented or reversed by any chance?
Yes, of course. If you catch them young, catch them early. Yes, of course. They have to try to, get de-addicted from those things. It's not that we should not use smartphones, we should not use laptops. The problem is overuse of these things. And then you don't have any rest in it. You don't take a rest. You don't have any exercise nowadays. Now, when I asked I asked my patient, when the young children come, and I asked them, do you play any games? Then I also asked them, I don't even video games.
Outdoor games.
Most of the time, no. Everybody is with the smartphone and playing on the screen, which is not good. You're using it for the smartphone is definitely a good thing. Using it for the right purpose. That's what we need to be doing. And these IT guys, most of the time they say, and the Narayana asks them to work for 70 hours a week. That's all not at all good for them. They should work. The problem with them is they don't know how to work effectively. They will be given some task. In between the time, they will be doing other works also on the computer. They will be watching something. That is why, you should be trying to do your work effectively, but you should do it in your time. And finish it off and go. Don't wait. Also, the problem is, all these IT companies, they give them good canteen facilities.
Distraction level is low.
So they enjoy that. They have their food. slowly have the whatever, then come back, and then reach home at night, 11 o'clock, 12 o'clock. And then they are not able to, even at home, there. This work from home culture is worsened. Because they have 24 hours working now. Because there are no working hours, they keep on working. So that's not great. So they should be taking breaks. They should be having adequate physical exercise. They should be also having some mental, relaxation. Trying to do some yoga or some meditation. Some physical activity, walking is. The problem is, everybody now they think that physical activity is going to the gym.
Exactly.
And they just want to do workouts. That's not what. Simple walking every day for 5 hours, 5 kilometers a day. Swimming. Not very good exercise. But the problem is peer pressure. You have to go to the gym now. That is not exactly what. Every nook and corner there is a gym now. There are people who are not even trainers there, and they're trying to do things which have been taught. That's the wrong thing. That's not the way it should be.
Since you mentioned about our gym culture in our youth, so I just have to bring this up to you because you have a lot of supplements. They say that it's good for your brain health. So
See, there are the best thing is natural. It's natural food stuff that you are. You don't need to go for any of this. And you go for this supplement, it's so very fast. Whereas everything is available in our normal diet. It's not that it's vegetarian or not vegetarian. You should have things in balance. You have a lot of vegetables, a lot of fruits. You drink a lot of water. You should take dry foods. All these things are very good for the brain. But the problem is here we take too much of fat, too much of sugar, which is killing the brain. Too much of sugar, too much of fats. These are not good. So you should use them in our moderate or try to cut down on these things. Take more fruits and vegetables and drink the water. That itself is enough. Now, all the supplements, when you go there, they will give you all this. You do not know what to do. Right. So, best is to go for natural substances, non-normal food. Best thing.
one last question, doctor. How will our sleep cycle or sleep deprivation impact our brain health?
Yes, definitely sleep. These are very important. The less you sleep, the more problems you have. Your lifespan is being done if you sleep well at night. If you sleep well at night, you can take care of your headaches. Your memory will be good. Your concentration will be good. You have less light levels grow. All your neurological conditions can be affected by sleep deprivation. Okay. So have a good 6 to 7, minimum 6 to 7 hours quality sleep.
Going to the last segment of our episode, which is rapid fire questions. Doctor, which is that one habit which actually improves our brain health?
You should be keeping your brain active all the time.
What habit that is damaging our brain health?
Sleep disturbances.
And one particular food which is very good for our brain.
Basically, it will be fruits and vegetables.
Dry fruits or
Dry fruits also. Dry fruits like, walnut, almonds.
Thank you so much, doctor. It was very nice having you here today.
You heard the experts. Now the action is yours. If this conversation made you think, then share it to someone who needs to hear this. Because health doesn't start in hospital. It starts with awareness. And awareness is the first step towards healing. This is Sukruta from Young Indians Mysuru chapter in collaboration with Apollo BGS Hospitals Mysuru, signing off.